Dr. Schwartlander, welcome to the show. What do you think of the importance that the Chinese leadership has placed on public health, both in China and international cooperation in this arena?
Yeah, the visit that we had yesterday of the top leader of the China government, together with a number of the top cabinet members, is really a historic moment. It is a reflection of the way the Chinese government and the president himself has put health at the top of the agenda, really embracing the sustainable development agenda as one of the first countries, by also putting out a Healthy China 2030 plan. And it also, of course, shows the importance that the government gives to the collaboration with the World Health Organization, looking after the health of the people, not only in China, but also in other places of the world. So we leave nobody behind, and everybody, no matter where they live, can actually enjoy the highest level possible of health as a basic human right.
Mm-hmm. It is very interesting that the Memorandum of Understanding on collaboration, on areas of collaboration between China and the WTO, on global health, security and humanitarian assistance. Exactly what are the contents inside in this Memorandum of Understanding, and how that's going to affect the medical work or the public health work of China and that of the WHO?
Now, the framework memorandum that was signed yesterday doesn't include a very, very precise work plan yet. That's the work that has to be done following the signing of this remarkable framework, but it very clearly spells out the collaboration within the framework of the One Belt, One Road initiative, which is a very important initiative, including for health. It is important because it realizes the fact that neighboring countries, the people of neighboring countries want to work together, live together, collaborate together, exchange their cultures, their goods, and don't want to be stopped by maybe traditional political axes, and they want to just move together forward in their development. Now, it is very important that health will be part of this dialogue and can be part of this dialogue. And we are very happy that we can work together with the government of China as a leader, as a main driver of this One Belt, One Road and One Belt initiative, and really make sure that health will be part of the dialogue, will be part of the exchange, will be part of the infrastructure building, so we can promote health across these roads and across this belt for everybody who is involved.
Mm-hmm. There was also another very significant activity that unfolded yesterday in the WHO headquarters, which is the ceremony to renew the appointment of the First Lady of China, let's say Ms. Peng Liyuan, as the Goodwill Ambassador of the WHO on tuberculosis and HIV/AIDS. What is the message you think we are sending there by renewing this appointment and encouraging China to go further in the fight against this disease?
The First Lady, Professor Peng Liyuan, has been a model ambassador for the World Health Organization. She has been a model ambassador for health. She has done a lot of work on health in China itself for her own people, but she has also done a lot of the work, in particular for some of the very poorest and most disadvantaged, for example, the orphans, the children that lost their parents due to HIV/AIDS in Africa, and that is very, very important. It is a sign that we are all living in one world. It is a sign that we should leave nobody behind. And of course, Peng Liyuan, the First Lady, is such a great model and a leader to bring others around to this debate and make sure that we don't forget those who are disadvantaged and those who are left behind right now. So we really bring them into the dialogue, and we bring them to the service they need so that they can really enjoy health and healthy lives for their future.
I understand you, as the WHO representative in China, must be very happy to see a closer relationship between the WHO and China. And since your appointment to this post in 2013, how have you seen China's efforts and performance in promoting public health stepping up? And where are the areas you say China needs to do better?
Yeah, you're right. I feel really privileged and really proud and happy to be able to work in a place like China with my colleagues there. And I personally think I have the best job in my organization. Now, I've seen and I've witnessed myself a dramatic movement. I mean, you have already mentioned in your report preceding this interview that China has engaged in what is the world's largest health reform project. Bringing people out of poverty, making sure that virtually every Chinese today has basic health insurance coverage, which gives them better access to health care, is just a remarkable achievement. Now, there's still, of course, challenges ahead in the agenda. The coverage of the health insurance is not deep enough. So many people need treatment, for example, which is not fully covered. So these are the things that we try to work on together with our Chinese colleagues. But we also have seen not many other countries that have actually put forward a Healthy China 2030 health plan for all the people, following the Sustainable Development Goals, which China has embraced in such a excellent manner. So we're really happy. I'm really happy to work here in China and really help the government and our colleagues and the people of China to move forward in a healthy, prosperous environment.
Thank you very much, Dr. Schwartlander, joining us from Geneva. That was the WHO representative in China. For me personally, this is also very exciting. I mean, for my 6 years working in Geneva, I covered the WHO more than any other UN agency, and you can imagine the kind of importance China is putting in public health information and public health work.